Welcome to Integrative Health and Wellness, folks. My name is Dr. Tom Ladani, and welcome everybody to our talk today. It's a pleasure to meet everybody here and those that are watching from home. Got a couple wonderful people that are going to be speaking today. I've got Dr. Gabby here. She'll just be up in a second. Dr. Kelsey Whitaker, she's going to be up just a second. Just a quick thing about me is I've been practicing chiropractic for almost 30 years. And over the last 5 years, I've discovered so much more about chiropractic. It's not just cracking. It's an entire integrative health. More importantly, it's finding out what different patients' needs. It's not a cookie cutter thing. It's every person's individual. That's why when I came on with Dr. Whitaker, came on with me, just brought on a whole new light of what chiropractic and healthcare was. And the same thing with Mary when she came on board. Same thing. She just brought on so much more knowledge, and I'm always learning. I always say I'm in practice. It's because I'm learning every single day. Every single patient is different. And one of the most amazing persons I've just met and I've discovered, or not discovered, she found us, is Dr. Gabby, who does pelvic floor treatments, stuff like that. It's just amazing for women. Again, something I never worked on for 25 years of my practice and didn't know anything about, and I'm embarrassed that I didn't know anything about that stuff. And I'm so glad I'm learning. I'm learning every day about that. And Dr. Whitaker will go into that. Miss Gabby, I'd love it if you could stand up and introduce yourself. And thank you.
Thank you, Dr. Tom. Hello, my name is Dr. Gabby. I'm a pelvic floor physical therapist, and I am so happy to be here today and to join you all at Integrative Health and Wellness. I am a physical therapist that specializes in women's health, so I work with women across the whole spectrum of life, but my specialty is pregnancy and postpartum. So I help women laugh, cough, sneeze without bladder leaks. I help them run, jump, lift weights without having to worry about running to the bathroom. I help women prepare confidently for birth and enjoy their postpartum journeys afterwards. And I also help them live a life without pelvic pain or pressure or pain with sexual intimacy, and just live a life without pelvic floor dysfunction. And one of my most incredible connection has been, of course, with Dr. Tom and Dr. Kelsey, especially because Dr. Kelsey works with so many amazing pregnant mamas, and she is a Webster certified chiropractor, which I always tell my patients that if you can work with a Webster certified chiropractor during your pregnancy and also postpartum, that is one of the best things you could do for your body. So I am especially grateful for Dr. Kelsey and everything she does, her incredible care. I always just go on and on with my patients that also see Dr. Kelsey about how wonderful of a provider she is. And I'm just so glad that she's here in the community. So thank you to both.
I'm Dr. Kelsey. I've been practicing for six years now, with a specialist in pediatric and pregnancy. So it's my passion. I love working with kids, and I love working with pregnant moms and postpartum too, because I feel like that's something that's super neglected after we have babies. It's kind of like you go to your doctor and you kind of get your 6-week appointment, and then good luck. Hope everything works out. So it's my passion to work with that community and things like that. I am very blessed because we came into a community that didn't really have that kind of support for our patients in the community that's growing with more and more younger families. So it's been a really big blessing to have such a huge support system with the people around us that we work really well together with, including Dr. Gabby, and having people to refer to and bounce things off of. We work great as a team. It's really, really fun when you work with people that you enjoy working with. There's a misconception with chiropractic that it is about cracking bones, just like Dr. Tom kind of talked about. And I hate using that word because it's not, we're cracking bones. We're kind of relieving the nervous system of some of the stuff that goes on inside of our bodies. Everybody has and deals with the common stressors of things in life, not to mention physical, but also emotional and traumas that happen throughout. Even with COVID and everything else, our nervous systems have been ransacked for a few years now. So we like to use different types of things to kind of use that to help our patients' nervous systems calm down, their immune systems work properly. So some of that anxiety of being sick, with kids that are sick all the time when school's starting, welcome to that time of year, daycares and all those types of things where we're worried about on the daily basis what our kids are going to come home to or what they dealt with on that day when they went to school. I have personal experience with that with my own children and dealing with a child who has ADHD and working with him and trying to get him settled, and chiropractic's helped him significantly, but we also kind of transitioned into using some of the essential oils that we're going to talk about today that he seems to respond really, really well to. And it's something that he can take to school with him and he can use that is not a medication, and it's not something that we have to worry about side effects necessarily with. It's something that he gets to try and he gets to choose things that help him significantly with his nervous system, along with correlating it with adjustments and adjusting certain areas of the body to kind of settle his body down. So we've been really, really blessed with a lot of tools that I don't know if I knew about so much when I was in chiropractic college, but learning as we go, like Dr. Tom was saying, when we have a chance to kind of meet new people and learn new things, like Dr. Gabby talking about how working with pregnant patients, I didn't even know that you could do pelvic floor therapy while you were pregnant. So it just opens up a lot of doors, and integrating all these things together is going to optimize your wellness. Doing one thing at a time and doing nitpicking different things and not having the whole group idea or the big picture, it doesn't get you where you want to go. And as long as you're motivated to do it, it really, really helps. My personal experience with essential oils is I started using them in chiropractic college, actually with a friend who did Young Living. She has POTS, which I also struggle with. And I've been using it now for my POTS as well, which for those that don't know, it's dysautonomia. So things that your body naturally does, mine doesn't like to do on its own. So I have to work on that, like digestion, anxiety, stress, fainting, lots of fun things. But it's definitely a tool that I used in chiropractic college for studying for my boards. Which I love using with my kiddos who are taking tests or kids that are doing things like that have a hard time focusing or transitioning from different subjects. So in chiropractic college, I used it for when I was studying for boards. When we had 6 or 7 different subjects, I'd use a different scent for each subject. And while I was studying, and then in between the board exams, I would use them and transition, wipe them off and transition to the next one for the next board. So that's kind of how I started with it, but I didn't really get into it too much. I love essential oils. I love the smells of them, but I didn't know the therapeutic benefits of them. And Dr. Mary, she used to be a chiropractor for 25 years, or she practices with, how long were you a chiropractor for?
In New York, over
Yeah.
5 years.
Yeah, for 5 years. And then she got into total body wellness, which is, I love that because it's more than just a chiropractic adjustment and things like that. And I started working with her as she came down here. It works in weird ways when things like that happen. But she showed me how it could help me too. I think I kind of reached out to her. I was like, please help me. Please help me. I had tried so many different things and I didn't know where else to go. And she did some scans on me and we kind of worked together on how my body would respond to different oils and what worked better for my body and things like that. And it's calmed down my nervous system significantly. Medications that I've been on, I've been kind of being able to taper up a little bit just because I'm not feeling so overwhelmed like I used to. So we are very, very blessed to have such a good group of people surrounding us that have helped not just our patients, but are helping us too on a daily basis. So I would really love for Mary to come up and talk to us about what she has to say and her little experiences that she's been through too.
So thank you to all the docs. Thank you for coming. Thank you for opening your doors to integrative here to me. So I know watching and in this room, we have a mom of less than a 1-year-old, mom of almost adults, if we could say adults, graduated, right? A mom of 7, who's here, who's an expert mom with us. But my story started many, many years ago. How many of you have had a time in your life where you felt totally overwhelmed, right? Like anxiety was knocking on your door, everything seemed like gloom and gloom. And that was me in chiropractic school. And this doctor friend came to me and she said, you need to meet this lady, Kathy. And Kathy was this very passionate woman. She had these little bottles she called miracles in a bottle. And she said, you need to try them. So I use this oil called Valor. Now make a note of that, write it in your phone, because this is an oil you can't be without. Love that, Valor. She said, Valor is a chiropractor in a bottle. Well, why? Right? I'm like, but I am from a science background, so I was super skeptical. But I tried it on several people's feet. And the next day, one of my student friends, he came up, he said, I slept better than I've ever slept in my life. And I was like, whoa, I need to know about this. So I ended up studying about the oils for a year. I studied these particular oils and I learned a technique called raindrop technique. So have you ever heard of it? Maybe it's, maybe you've experienced it. Rebekah's going to share a little bit about her experience with raindrop technique. But it was just a beautiful technique. And about a year into it, actually for me, a couple of weeks into using that Valor, it was like the light came back on, right? So I know a lot of moms, we've had pregnancies, unfortunately, I've had many miscarriages and stuff too. I'm going to show you two tools that you can use to really help with grief, with all different things. So let me dig in. So what are essential oils? This is my one tool that I've used through the years. Chiropractic, of course, being like the mainstay of everything that I learned, but it's like I layered essential oils and really became an expert in that. And we love this mom's class, and he is, and all kids are free to run around because this, and you'll hear from Rebekah in a second, this is like our next generation, right? And how many of you agree, like we're growing up in the most toxic world, whether it's what we watch, what we take in. You can't go buy a car anymore without chemical diffusers and chemical this and chemical that. Like we want to fix everything with chemicals, and I'm going to show you how to use some natural things. Speaking of which, let's talk about essential oils. So what are essential oils? Essential oils are the lifeblood of a plant that initiates regeneration into the cells. Anything that our blood does for us is what essential oils do to the plant. Think about that. Like, it's not like they carry nutrients and oxygens to different organs in our body and can effectively combat the damaging effects of toxins, impurities, harmful substances in and around, right? And they never expire. Like, that is something like they can sit on the shelf, like don't put them in the sun because here in Florida, they will evaporate, but they're in plants, right? They're in tree, resin, herbs, they're in everything, bark, leaves. It depends on the particular essential oil, how they are distilled. I'll talk about that in a second. But they are immune enhancing, they support the body's natural defenses. They're high in antioxidants, they're aromatic, they're oxygenating, they boost stamina and energy, they help you relax, they help you manage stress and frustration, they improve mental clarity and promote overall health, vitality, and longevity. Now, if you're a mom, you probably want to know one of four things or all four: sleep for you and for them.
We had that discussion.
Energy, right, for you and for your kids, and moods. I think that's another big one. Allergies, I find, are huge here in Florida, right? And even up in New York and stuff too. And how can we boost our immune system? We all want to do that. So we're going to talk a little bit about that. So there's three different ways that you can use essential oils. Number one is diffusing. So you can see over here, we have one of our beautiful diffusers. I love this diffuser. It's called the Desert Mint. I love it because it's kid friendly. This is plastic. If I drop it on the floor, it's not going to break, but it looks bougie. So
Classy.
Classy, all right. So we have that diffuser. We'll show you a little bit. We have Feather the Owl, which we have on special.
Love that one.
So you love Feather the Owl because it's a sound machine.
It is. It's got many different ones. It's got the white noise, and it's got the rain, and it's got the musical stuff aspect to it. It's very calming.
Yeah. In a minute, Rebekah will talk about like that's like a staple in their house. They have it going all the time. So there's all different types of diffusing, but a lot of people ask me, can I put oils in my burners? What we're talking about today, Young Living essential oils, they're premium grade. They're not made artificially, right? So it's not a burner that you could use or anything, but for here in Florida, it's very, very musty. and other things that grow. So you have the water diffusers here, but then you also have the straight diffusers, and these are really good if you're in an area or an office, not that I smelled that in your office, but in an office too, that like, it's just a lot of moisture and stuff. You want to use this, and if you have a lot of lung issues, you might want to invest in one of our straight diffusers as well. So diffusing. 75% of American homes use synthetic air fresheners that contain numerous amounts of chemical agents that have been linked to cancer. Formaldehyde is an air freshener. The olfactory nerve is the pathway to the brain. When it is being hit with formaldehyde, it will disrupt your endocrine, your hormone system. It actually deadens the nerve, which decreases the nose in which is able to smell well. Formaldehyde is the #1 cancer-causing chemical, and it is no good. Okay, so just think about that when you're using candles or air fresheners and stuff. And this is not to make anybody feel bad, because I had to learn this and I had to slowly come off of this. We have a friend, she left her Bath and Body Works perfume. She said, I'm never changing. Well, a couple years into her journey, she is forever using Young Living essential oils now for body sprays and all those things too.
I feel like it also, the oils smell longer.
Yeah.
Like, you have to keep reapplying the bad stuff to your skin, whereas the essential oils you don't.
Right.
It's
Right.
just that you can smell that for like hours rather than like, oh, you have it on your skin and just so thin and then
Yeah.
gone.
Yeah, and so let's talk about topical. When I put an essential oil or actually anything on my skin, this is your largest organ. So I can measure in my blood the constituents, what's in there. But the great thing about oils, they go in your body and they're out. Rebecca's going to talk a little bit in a second about safety, like with babies and all that, how she applies oils and stuff too. But when I use a chemical on myself, right, I'm just adding and it gets in my fat tissues. And so many women are like, why can't I lose weight? Well, if your body is overtoxinated with toxins, the fat tissues aren't going to let go, because that would be harmful to your body. But that's a whole nother talk. Weight release, we'll talk about that. All right, so we can diffuse, we can apply them topically. The feet are a very safe place. You'll hear some other ways how we use them, and you can actually use the oils internally. Many of our oils are food grade. That's really neat. Or you can even put oils in like a veggie cap. And I'm only talking about Young Living essential oils. I'll pass those around and stuff too. I'm only talking about Young Living essential oils too. All right, so safety tips. Do not put oils directly in your eyes, but I can tell you, and Rebecca can tell you how many times we've gotten oils in our eyes. You don't use water because water drives oils in. So you use a base oil like olive oil, coconut oil, something like that, and just dab around there as well too. Men and little boys, if they're using straight peppermint or some of our hotter oils and they go use the restroom, it'll, sensitive areas. So just be aware and stuff of that as well. But there is safety. Your citrus oils are photosensitive. So citrus oils are, they will magnify the sun. So citrus oils, if I put an oil like Joy, which has bergamot in it, or Citrus Fresh on straight and then go sun tanning out in the sun, I'll get a nice tan or even a burn depending on your skin too. So just be aware of that as well too. So that's a little bit about safety. But I will tell you, in all the thousands of years that people have been using essential oils, taking them internally, externally, and I'm talking about premium essential oils. Young Living has what we call seed to seal guarantee. Like, if we don't grow it ourselves, and we have 31 farms all over the world. If we don't grow it ourselves, our partner farm, we know what's in the ground. It's even higher than an organic standard, because that's not a world term. But it's pristine. And if we get an essential oil from one of our producers and farmers that is not pure, we reject it. So there will be things that go out of stock, and that's because we put premium, we put people over profit with us too. All right, so I want to invite up a very special woman who's going to share about how you can have your kids sleeping better, feeling better, all the owies, and I'm going to pass oils around while she talks. So please welcome my good friend, Mama 7, who's been using essential oils for 10 years. Awesome. Well, we are so glad that everyone is here. You ladies are so special and you are so loved. And I think that's always important to hear because we work extremely hard for society. And I definitely feel a lot of times like a person under the rug. And that's okay. I don't mind that. But at the same time, I think you need to know that you are loved and that you are absolutely appreciated. Sorry, I just really, really love you moms. And I know that you guys all do so much for all of us. So thank you. And so, yep, my journey with Young Living started, let's see, 2014. I had already had two littles. They were under the age of 3, a little girl and a little boy. And I had extreme postpartum depression. I had a lot of side effects from the medications that were given to me for pain after both births. And very traumatic births because of things that were suggested to me to bring the baby forward maybe a little bit before my body was ready to push it out. So yeah, sorry, I'm very emotional about this because, you know, I know a lot of mommies get in our positions where you kind of feel like you're not sure, you know, there's so many new things about being a mom, especially when we're first time moms, that it's very, you know, hard to sift through all of the what's right, what's wrong, yeah, is your intuition. I have to say that usually, if not almost 100% of the time, what you feel about your family and your child is usually correct. If you see something's off, if you see, you know, you're usually, your instincts are correct. So don't ever doubt the instincts that God placed in you. I just feel like they are very, very vital and they're there for a reason. And search, don't just immediately like take about 1, 2, 3, you know, opinions, you know, before you just immediately, you know, go down the path of doom and gloom, like, oh, everything's, you know, nothing's working out. So yeah, so I started using the essential oils on myself. I used the raindrop therapy, which was really essential. It's a group of oils, single oils, right? They're all single. Pretty sure. And they place them on your spine. And I had a lot of inflammation in my back. And that was really hard because I really didn't want to get up off my couch. I had awful thoughts to just end my whole entire existence. And that there was no happiness in me, which if you grew up with me, my parents called me the Energizer Bunny, that I brought a lot of joy and all this other stuff. So it was complete opposite of who I was growing up. And so I had called Mary, Dr. Mary, and I had asked her, because I've been deep in prayer, and I just was at the bottom of the barrel, and I said, I need you to guide me. And so I heard a voice say, call Dr. Mary, and I called her and she answered, which I know wasn't easy to answer her phone when you're as busy as all of us mommies are to have a pickup like that. So she did, she picked up and she said, okay, I want you to get into a raindrop and I want you to get adjusted. And I was like, good and good, you know, I had direction. And so she got me the number for the raindrop. And I called and that same thing, the lady answered right away, which like, I just was shocked, you know, who answers their phones right away nowadays? I mean, we got texting, you know, what to say. Voicemail. And with reception, right? I mean, hello, I mean, you're guaranteed the best reception, but. So I got an appointment like a day after, and immediately after I got done with the raindrop session, I had like, almost like, it was like my head, I could think a little, which was incredible because I had been, what, about almost 3 years since I've had some really good clarity in my mind. And then the inflammation in my mouth, because it was causing inflammation, like if you had had a bunch of cavities, but I didn't have a bunch of cavities. I had tons of, my gums were always inflamed, always bleeding. And my spine, from my neck all the way down to my tailbone was completely just inflamed. It was awful. And then she had taught me, the raindrop therapist had taught me, and Dr. Mary,
that different essential oils and their properties and the things that they do actually pull toxins out of our spines if we've been exposed to anything where it could have gotten trapped into our spine in any way, shape, or form. So, and I know a lot of mommies have to get epidurals and different things like that. So, and I actually knew a lot of women that ended up getting some really bad physical issues after having to do that. So I had a lot of hope, went home, had some detox symptoms. I had, everybody has a little bit of detox symptoms, just drink a lot of water if you do. And I woke up next day, I'm like, I'm gonna do this again. I told my husband, I was like, I actually feel like, because there was a point where like, I didn't feel fun. I didn't feel like I could have fun, that's a sad place to be. And so that was my raindrop, the beginning of raindrops, and then chiropractic. I went to chiropractic and she did the Webster and everything. And I brought my kids immediately after I got it done because I was like, this is so important. Like, just like getting our teeth checked up and everything else, having our spine checked up was so important. And so I started going faithfully, made the budget because it was really hard financially for us, but I was like, this has to happen because I'm gonna end up having a major hospital bill. So I moved around my budget and made sure that I could fit in the, pay out of the pocket because the insurance and stuff wasn't really gonna cover any of that for us. So that was something as a mom we do have to look into, as way where we can budget things that are gonna be important, preventative care. So another thing that of course, having the little ones, teething was a big issue. And anytime I used the stuff the doctors prescribed for me, for the kids, it ended up all over me. And it ended up all over their clothes and it was really stinky. And teething was a really big problem for my first two. First two was really rough. Teething, and my third was pretty rough. And I had gone into a essential oil dictionary, so to speak, and it talked about things for teething. And I had come across copaiba. Copaiba it comes from the bark of a very large tree. It is an exciting story to read about how they over time, the ancient medicines and the way that people found that things helped through nature by following nature, like the things that they hunted and everything. It was pretty incredible. So they would follow the deer and they'd be resting and healing and licking the copaiba tree. And later on, the indigenous people realized that it was such a huge healing problem. It brought the inflammation down in the creatures. So they started applying it.
I don't mean to interrupt you, but
Yeah.
if we lived in South America, our moms would teach us to use this for digestion. You would find it in every store, every place. It'd be digestion, inflammation. It's like the cure-all.
Yeah.
Topical only? Or
No, internally.
Yeah, eternal, topical, and aromatic. You can do it for all three, which was such a wonderful relief for me. And it's such a beautiful flavor. The kids absolutely embraced it when I would put it on them. I never had to fight them. I would just put a little on my pinky and then I just rub it on their gum areas where they were sore. And eventually they just stick their tongue out. So, yeah. So I didn't really have to do too much because they just knew it helped them, which was so cool. Like I was just like, this is so awesome. There's no stick mess. There's no this, no that. And no side effects. They were never drowsy or they could still function, run around and do all the things they were going to do. Right after you wake up, you shouldn't be that drowsy after you just woke up after 12 hours. So I was just like, okay, this is cool, and that really spoke to me as a mom because I hated seeing my children in so much discomfort. And so that was a huge speaking point. And then of course, the lavender for just all things. We call it the Swiss Army knife of essential oils for a reason, because it literally will cover A to Z as far as like, if you have to have one oil in your bag, grab your lavender because it will literally help you. It's what Dr. Mary actually shared with me when she got a burn
Mhm.
from the stove, which I think we all use stoves here. Yeah. Yeah, no scars. Yep. I put it over our heart just for any kind of like emotional support.
Show us how you do that.
Yeah, so usually like with me and my children, like at night and in morning time, but in the nighttime, just to calm down, we'll find our heart. And it's a great way to teach your children anatomy too, you know, just where their heart is.
Mhm.
I'll just be like, hey, let's find our hearts. Let's write a little heart. Sometimes I'll just have them take their oil. I'm like, we'll just do a little heart. I was like, and then talk about our day and let's say something that we just loved about it. And then how much we're gonna love seeing each other and having adventures tomorrow. And just really helps bring down the mood in it. And just the smell alone just kind of brings the child from all the wild of the day
Mhm.
right to where you and they are. And it's really, really beautiful. It's a beautiful thing to see because, you know, we have a lot of stuff going on every day.
Gabby?
Yeah,
Yeah.
is it safe for their skin?
Yeah, so one of the things that I had to do because even though I have, you know, 6 children that I applied on to now, I do apply to my stomach, so this baby gets oils too. But at least gets the smell and stuff, but yeah, and I do ingest while I'm pregnant, so the baby does get it's in the blood there. But one of the things that I will start doing because our biggest are in our feet, and it's most effective really to get into your body is because they even do the foot technique, the Vitaflex, which is so awesome. Oh my gosh, if you haven't done Vitaflex technique with the oils yet, I highly suggest it. And so I'll just start rubbing on the spine of their foot, and then I'll rub it in because the tip of the toe here is your brain, goes right into the brain there. If you put it there, and then of course you get the rest of your organs and stuff throughout your foot. And so I'll just rub it on, and they love a good massage. What little kid doesn't love a good massage? It's a great way to introduce them to it. Especially if they're really high, like highly sensitive to smells, which I know there are kids that are just like, and I even am, you know, really, there's some smells that I'm just like, but yeah, so just start in the feet. And then if you know, and they come into effect like easy 10 minutes, if not sooner. And so if I'm using it to like treat a cold or something yucky going on, whatever, if like especially peppermint, that works like that, like the temperatures come down
On the feet.
immediately. Yeah, immediately the temperatures come down. That's our temperature reducer. Yep, that's our temperature reducer. Because I was taught that your temperature being raised isn't a bad thing. It's how long it stays up. Because the heat is actually trying to obliterate the yuck inside. But but just to that it can regulate, right? That doesn't stay up high too long. So but the peppermint immediately, and then they fall asleep. And then they get rest. It's incredible. That's happened with all my children. That's happened with my husband. That's happened with myself. So it's not just me. And I'm one of 11. I've seen it throughout all my family members. I've seen it through their spouses that aren't blood related, you know.
I'm gonna just pause you for a second and add a couple of things about lavender and peppermint. So lavender has been studied by Wake Forest University to be more effective than Ambien. Wow, so yeah, so our lavender though, it has to be Lavandula gustifolia. There's a lot of lavenders on the market, but it's a particular type of plant.
Yeah.
That has all of these constituents and healing properties and stuff too. Yeah, yeah, and I'm gonna pass that around. Just smell it. You're welcome to put a drop and stuff too in your hand, but we don't want to overwhelm if you're
Yeah.
brand new to oils. Just use a little bit at a time.
How would that be used for sleep?
Okay. So diffusing in the diffuser. So question was, how is lavender used for sleep? Diffusing 3 to 5 drops in your diffuser is just amazing. In our house, cedar wood is also very, very good for sleep, highly researched, great for the brain. I have an autistic son. So we do lavender and cedar wood in diffusers at night. So that combination, you can use it on the bottoms of your feet, and you can create a little spray. We have these little spray bottles which help your oils last longer, and spray the sheets. and stuff too. So it's just a great one. And then I wanted to share with you too, just Rebekah's talking about her kids and so many moms, and we're thrifty, right? We're thrifty moms. And I was working with a thrifty mom one time, and had her little oil kit that Rebekah is behind Rebekah there. And they're 5 ml bottles, and she would put a few drops in the bathtub at night. And she said, Mary, my 2 and 3-year-olds, like, they go to sleep so well after that. She couldn't believe it, but she's thrifty. So she went to the health food store and found a $8 bottle of oil that was like this big. And she used 3 to 5 drops, nothing, 5 to 10 drops, nothing, 20 drops, and still didn't get the results. So this is what we're talking about. It's not concentrated. These are pure oils.
Yeah.
Does that make sense?
Yeah.
And I'll tell a peppermint story later.
Yeah, no, the 100% essential oil, because it does make a difference. And also one thing that my husband came to realize is that one of the ways you know that they are in nature and being grown in their habitat, their natural habitat, is that some are sweeter, some seasons are sweeter. In France's,
Peppermint, right?
Yeah,
That's one that'll
yeah.
smell different season to season.
yep, even lavender will have a little bit of a variation with it, and that's why your body will never become like, so like with, when you go to the doctor, they'll tell you, oh, we gotta up your dose and things like that, because your body becomes, what's it called, it has
Resistant.
yeah, resistant
Yeah.
with the essential oils, because they're constantly, they're new crops, it's not all from the same crop all the time, it can't be duplicated that way. They're not synthetic, there's no synthetic in it, that your body you can always use the dosage amount, and it should always work exactly how it says. If you will never have a resistance, which I thought was really, really good, because Lord knows we don't want to keep on upping the dosage.
Address allergies and lungs. please.
Yeah, so RC is one of their blends, Young Living's blends. It is a powerful respiratory blend that I absolutely love. They have the 4 different eucalyptus in it. They have pine, they have myrtle, and then a lavender in it. And so even if you're like, oh, like you have lavender, but like maybe you ran out of lavender, this still will have lavender in it, and you can still put it in the diffuser, and your child will still get some lavender from it as well. But that's the one I put in. It doesn't keep your child's brain stimulated at night, which is really important to know, because you want to bring things that are calming. It gives them that deep breath that they need, and I need, and you need, to help get us to that deep REM sleep. So when I put that in, I do about 3 to 4 drops in the diffuser, and it runs for about 4 hours. And by that time, I've gotten some really good, I used to have such bad, awful breathing. It was so bad. I mean, my husband was like snoring and stuff like that. So, and even him, so since I've made that kind of a priority to put not only in my room, but in the kids' rooms and stuff like that, I've noticed such a difference in our rest. We sleep so much
Does
better.
everyone have a diffuser in your home?
Yep, everyone has a diffuser. We actually use the owl diffuser because it has 3 purposes. It has a night light if you choose to use it. It has all different sounds for night and day if you choose to use it. And it also gives you your diffusing needs, your aromatic needs. Instead of using a flame, you're just using water and then the essential oil, and you only use 1 outlet. Love that, especially because I have an old house.
Yeah.
So I'm not like outlet for light, outlet for diffuser, outlet for music. So, yeah.
Can you talk about the kids line? And then I'm gonna have Dr. Kelsey talk about her favorite kids line.
Oh my gosh. So when Owie oil came out, what a gem. This is newer with the roll-on, not that we couldn't have created our own roll-ons, but they have the kit now in the roll-ons. And anytime that, even with inflammation, like this is great for inflammation. So if, the kids, like you're out on hikes, walks, whatever, they get stung.
They're diluted so that you can use them straight.
Yep, they're already diluted. I've never seen a reaction so far with any of my kids with just using this directly, because like you said, they've already diluted it. So that's such a huge plus, because I don't have to carry around the coconut oil or V6 and the essential oils. I know it's all diluted already. So that's a huge plus. So, and then being a roll-on, you don't have to worry about getting it on your fingers and then rubbing your eyes, you know what I'm saying? Because I used to do that all the time, still do, really. But But yeah, so I'll just put it on like my lower back here if I have some lower back issues, and then I'll even do it up here. This has helichrysum in it, which is really, really helpful for if like you have scar tissue and it's like knotted, it's painful. I've had a surgery. I'd had my appendix taken out while I was pregnant with my sixth. And this was such a godsend too. And they say not to like put stuff around, but I did do I kind of did it on the outside. Actually they did staples on me, but I did the outside and around all the areas, and the healing and just the comfort, because it was throbbing so bad. It just brought so much comfort to those areas after surgery. And that was super, like you're already like 38 weeks pregnant, and then you have, the staples, and you're trying to stay like on your back. Hello, that's like,
Soft children.
yeah, you gotta get up and feed your kids.
Yeah,
through school. Oh my gosh, that was fun. So this really helped me get through a lot of pain myself, but I also, all my kids, they go to Owie oil. They're like, Mom, where's the Owie oil? I just got stung. Mom, where's, the Owie oil? I just like landed on the road after like flying off my bike. Like, they go to it themselves. I don't even have to tell them. And then Sniffles, this is another great diluted kid scent collection item that they've created for our peace of mind, that you can just, apply.
Before Dr. Kelsey comes up, talk about thieves or oils that you use that keep your kids healthy. Cause we all.
Immune system, yeah.
Immune
Yeah,
system.
preventative immune system boosting help, yeah. Thieves essential oil, you gotta read the background on that. That is there's incredible history on the Thieves essential oil itself. And the specific single oils that they have in that blend, but we will use it on our feet. No matter if we're going, for a walk, or we're going into the stores, or we're going into an airport, we're going to travel for family vacation. I'll always put that on the bottom of our feet, and I just noticed that we've never, and we've gone on all these trips. Kids have always been healthy.
Yeah. And what I like about Young Living has now a diluted Thieves roll-on, so that just makes things a lot easier. You can always dilute it and create a roll-on yourself
Yeah.
as well too.
Yeah, and the kit they give you the roll on top, so you can stick them right on too.
So Thieves comes in a roll-on, and it comes in our Vitality. So all of our Vitality blends can be taken internally. The government says you have to have 2 different labelings. They are the same oil in each one. Just understand that, but you have to have a food grade one and whatever topical diffusion. But you could use both oils in your diffuser. They are the same oils. Now, what's nice about that, I'll tell you about my friend, chiropractor, Dr. Karen. She's a single mom. And she would put Thieves Vitality in honey and water for her kids every morning before they went to school, because she could not afford for them to be sick. Perfect attendance, friends. That's what chiropractic care and good food and essential oils do and stuff too.
Yeah.
So Dr. Kelsey, I know you want to talk about some of your favorites here too. Thank you, Rebekah.
Oh, no problem.
So with the people that I treat, I have a vast majority of my patients are on some type of spectrum. I treat all kids, but I feel like now in the day and age, we're either in a hypersympathetic mode where our body's in that constant fight or flight, no matter whether it be anxiety, ADHD, autism, all those things. And we've talked about lavender, which is traditionally used to calm the body down, but some kids don't respond as well to the florally scents or things like that. So I feel like the first one that I think that's the first one I ever tried with Mary that she opened up for me was the Kids Power. And the Kids Power is a little bit more on the veering of a citrusy type smell, which is interesting. So I learned from her a little bit that the citrusy smells sometimes are better for those who have a little bit of overstimulation, because it rewires and readjusts them. And it works great, especially post adjustment. I find myself, if kids are still kind of a little bit overstimulated or their bodies are still taking time to settle down, especially since school has just started up. I've seen it a lot this past week. Just taking that time and applying some of the oil on them, have mom check it, have the kids check it. Cause again, I like them to smell it too, because sometimes they're like, no, absolutely not. Very few have not liked that one. But it's a little bit calmer. It is a little bit more citrusy. I like to diffuse it too in the room because then we start off with the adjustment with already kind of settling down their nervous system. I use that one with my kiddo who has ADHD. We bought the roller. He's got a little bit in his IEP that he is allowed to have that at school, and he's allowed to apply it. Some schools are very weird about it. Some don't mind. I feel like they're allowed to wear deodorants and bring perfumes to school. They should be allowed to bring an essential oil roller to their classroom. But I like to use that on my son. We use it at nighttime. For him, it helps him a little bit during nighttime as well, because he tends to not sleep so well because of mind racing about the next day. But we also start his day off with it first thing in the morning, brush our teeth, put that on, get started with the day, eat our breakfast, and then he carries it with him, especially during tests, because he has test anxiety. It works really well for me. I know it's a kid scent, but I love it too, just like she's using it for her. I love it because it's a misconception with ADHD with adults and females especially, that anxiety is anxiety rather than a representation of ADHD. So it's, we don't get the same criteria as boys do. It's written very well in the DSM, but we don't get that type of classification like they do. It's much harder, and usually we find out in our 30s. Here I am. So I just found that out a few years ago, and I love lavender. I like all those too, but this one really, really helps my body settle down, and it helps my son significantly. He still loves the lavender. We went through this morning when we were putting it in my office while they're sitting in there, and I'm like, which one do you want? Had them both smell it. I have two children. They love it, right? They're like, here, and they're like, because we're all getting used to that in our household, because we've applied this into our house, and we've got the cleaning supplies and all that kind of stuff too. So we're trying to do exactly what Mary did. We're kind of meandering out of our way of that we've used to do, and trying to be more conscious of what we're putting on our bodies. I have a long family history of a lot of different things, and I want to make sure that they have the best chance they can get. It's, we know better. When we know better, we do better. So we're doing that with our house. But Kid Power has been life-changing for my one son who has test anxiety. He went through a little bit with a bullying situation at school a couple of years ago. That was very traumatic for both him and I and the whole family. But this helps settle his nervous system down, and that he can go to school and he's not having anxiety or worrying about what's going to happen that day. But it's one of my favorites to use on him. And like I said, I use it in practice with my kiddos when they have anxiety. We have a couple that have gone through accidents and their nervous system's on fire, because that's a trauma physical and also a trauma psychologically, especially as a young kid. And we tried to, we went through quite a few oils with her, and she loved Kid Power, and then she loved the citrusy smell, which for her she loved, which was, I think, Citrus Fresh she went with, which has lavender in it as well, right?
Actually, I don't think so.
That doesn't?
No.
Somebody had said they smelled lavender in it. I was like, I don't know. I'll have to ask Mary, but they gravitated towards it. So it's a bunch of different citrus smells into it, but a lot of kids really respond to that. It's a good energy booster. It doesn't really make them wild. It just makes them, it makes them calmer and like that clean energy. And I love that for them. So I really, really love using the citrusy smells on my kiddos during the daytime, but we use it at nighttime too, just depending on the situation. But we love those oils for our kids.
Talk about Digize and Tummy Jize.
Digize is my favorite. I use Digize a lot because of my POTS. So like I said before, I have a dysautonomia, which like digestion, anything your body does naturally. So eating, going to the bathroom, nausea, because blood flow goes to a surface area and it just like plummets. So eating was very, very difficult for me. I really struggled with it for a really long time after I got COVID. I lost probably 20 pounds. I was probably 115 pounds when I was my sickest. Went to a bunch of nutritionists, went to counseling, did a lot of other things. But anything that my body does naturally does not want to. So I've been using Digest for not just nausea, which it really, really helps with my nausea. And I have a bunch of kiddos I treat, because once somebody finds out that you also have something that's very similar to them, they find you. And so, but that's a blessing. So if that's why I have it, then that's fine. But I use it for myself. So anything I tell my patients to use, usually I've tried it for at least a month to make sure that they're going to be okay and it's okay. And I have experience to share with them. But the Digest helps with my nausea. So I apply it before I eat. I don't know if I've taken it sublingually yet or like actually took it, but I usually apply it here into my stomach. And that has significantly decreased my nausea. But even I tried it out when I was having some issues with hormonal stuff, with the bloating and like we all know how we feel when we're on our cycles and stuff like that, and just applied it overnight because I was feeling gross and I was like, I'm not gonna be able to sleep because I can't get comfortable. Less than 10 minutes. And I'm like, oh, okay, I can go to sleep. So I'm like, it was great. So I love Digest. It's my favorite. It works really well for a lot of people. You can come up with anything, constipation, diarrhea, all those things. I live for that one. It's in my pocketbook, in my wallet, and in my office. I have it all the time. So I carry that with me.
Yeah, my son loves it too, but the kid version is tummy jive. So
Yes.
it's very diluted. They
Yes.
can apply it themselves if they
Yep.
want.
I've done that a lot with constipated kiddos that come in. There's a big misconception, and it's unfortunate that it's very well known. You can Google it and you'll show that, oh, breastfed babies, it's okay if they don't poop for 7 to 14 days. No, it's not normal. It's not okay. And pediatricians are saying this, and it's very frustrating, but if I have to be the one to stand up and say it, I'll say it. That's not okay. So we use it a lot on them. We're doing the same kind of thing, like with chiropractic, we do rainbows, we do the bicycles, we try to get their psoas muscles and everything else kind of settled down too, to make sure it's not structural. But there's so many things going on in their bodies, whether they're vaccinated, not vaccinated, being at daycare, all the things that happen. It's a really good thing to apply to them and just kind of put it on their stomach. If they're not eating it, it makes mom panic. Everybody is upset when the kid's sick. If we can just do something so simple rather than, okay, give them your Miralax, which I have a lot to say about that, but I'm not getting to that. There's psychological relax, and it's proven to do so. If we can find something that's not going to cause side effects, then we should be trying that at least first. If it doesn't work, and there's cases that there's things that are outside of our ability to fix and they need some intervention, then we should be trying those first. So I love using that on my kiddos. Usually by the time they leave with an adjustment and tummy jives, they have blown out their diaper, which is why we have a changing room with extra clothes and diapers and swallows. So if anything does happen, you are safe to go home in a clean car seat. So we use that quite frequently. I love that one. We use that a lot in our office, and I use it on my kiddos too. Just even with autistic kiddos, they have a lot of gut issues as well. So we use it on them for helping them they deal with a lot of constipation and gut dysbiosis, and that kind of stuff kind of settles with evacuating their system. If we have a toxic gut, our whole body is going to feel inflamed. So if we can kind of get to the source of it and get it calmed down, that really, really helps them. So I love those two, well, 3 of them. I love the 3 of them, but they work really, really good for my family. I use them on a daily basis. All my kids' favorites, but I like all of them. I like the Genius too. That's a good one.
So so you've heard about a lot of oils, right? So sometimes it can be a little bit overwhelming when okay, I heard about lavender. I need my baby to sleep better, and I need to sleep better at night. I need to get really good deep sleep. I've heard about different things. One of the things I just want to cover before we close up and just share with you how to get oils and diffusers is about moods. One of the things, when we smell a smell, it goes directly to the emotional part of our brain. So I can smell something with thieves that has like cinnamon in it. I remember grandma's oatmeal cookies, right? So memory and smell, right? We're all the anatomy people here.
my
Studying.
yeah.
But one of the things for me is when I had my first son, I had a very long not labor, but just many days and I'm a very strong woman and I can take care of everything. And I didn't let anyone take care of Josh and I wasn't nursing well. So I was up for 4 or 5 days and it's just one thing over the other. And about 2 weeks into it, I was just living in my pajamas. And my mom came over and she brought me this essential oil called Joy. And she put it on some tissues and she put it in my pocket of my pajamas. And I remember smelling down and inhaling that, and it was like the light bulb just came back on, and it was like, oh, wait, I need to ask for help. And I've used that oil several times. So that is a common one too, when you have teens, who are having a lot of issues, or even just little ones, because we go through spurts, or we've had a loss or grief, anything like that. So that's called Joy Essential Oil. But in your premium essential oil kit, there's this kit of oil that we talk a lot about. One is called Stress Away. And that has, remember Rebekah was talking about copaiba? Smell this oil. It's so beautiful. It's just such a good oil to diffuse. Ladies, it's a good one to put in your hair as a hair diffuser. Your hair could be a diffuser.
I didn't know that.
Yeah.
You know, my hair is curly.
Yeah. So Stress Away is just so wonderful for really, like, honestly, I put it on my tongue. It's got vanilla and lime and copaiba. And I just feel, I don't know about you, Rebekah, but I feel like, okay, I can hear you now, because a lot of times those of us too are work or homeschooling and all that. It's like, we still have business on the. So when we come home, we're not actually connected with our kids, right? Or our husbands. It's like, we have to have that. So I suggest that oil as a good one to be a good transition. But for my teens, my preteen, my daughter now, her job is to put stress away in diffusers in the morning. And it's like, it changes their moods. It literally, that's her favorite oil and it changes their mood. Okay, so we've talked about a lot of oils today. We've talked about the purity of essential oils, what sets Young Living essential oils apart. I can only talk about Young Living because that's what I've worked with for 25 years. Maybe you have another brand you use, but I can't say what we said today is applicable to those brands. It's only the ones that I've experienced with and we have experience with today. And, moving forward, we know that usually people come to class or they watch the recording and there's like 3 levels, right? There's like, I'm just curious, just like learning, getting started or whatever. There's those of you who maybe have experienced some technique, you want to learn more, like, okay, where do I get started? And then there's those of you like, okay, I'm throwing the baby out with the bathwater. I'm all into natural health, all of the things. And you'll be like me, who now has a 14-year-old, and last year was his first sick doctor visit. And it was because we were forced to, right, from his new school. But anyway, but the point of that being is that between chiropractic, good nutrition, physical therapy, and I didn't say this about Dr. Gabby, but I just got to be one of her patients, and I'm almost 50, and I'm going through just about through menopause, and like one visit to her has changed everything for me. So if you haven't, you got to go see her. All right. So, and then the third type of person is all in. So if you are a person who's just curious, I encourage you to walk away, like pick one thing. Maybe it's stress away, or maybe the copaiba for teething. Maybe, pick one thing. We have oils here that you can buy retail. If we don't have it in stock, we can give you a little link and you can purchase it and it gets delivered right to you. And I am going to back up integrative as well. If you use it and you're consistent with it and it's not a good fit for you, I will give you a money back guarantee. So you don't have anything to lose. The second person who's like, okay, I've experienced these, and the best deal that we have, the premium essential oils kit, it comes with, what did you hear today? Citrus Fresh, Peppermint, Valor, my first oil, Lavender, Digest, Thieves, Panaway, which is one of our pain oils, Raven, that's one of our respiratory, similar to RC, frankincense, which we can't say enough about, right? Lemon, Stress Away, and Peace and Calming, which is a favorite essential oil, great for dogs too, who are afraid of thunder and lightning and all of that too. So that whole entire kit with a diffuser is $165. And with tax and shipping, I think around here, it's a little less than $200 and stuff too. So we have that. And then the third type of person who is like, I'm all in, I'm gonna encourage you, get started with a premium starter kit and then really start like Dr. Kelsey is doing. Every month she's going and she's like, okay, I'm gonna take one thing and switch it out, my cleaning. Because next month, we're gonna talk about nutrition. We're, the month after that's gut health, detoxifying your home, raindrop technique. We're gonna pull a group of you together, maybe want to see it demonstrated or learn it for your family members. So we have all of that. So get plugged into our classes, make sure we have your information so we can text you and let you know when our next classes are. And just slowly make that difference. So if you're watching today, we thank you so much for coming. We thank everyone here, but get back to the person who maybe invited you or sent you this, if you're watching it later on, and let us know where you are. Are you person number 1? Okay, I'm just curious, ready to just test. Are you person number 2, ready to get started with, some essential oils, or are you ready to like really learn how to change everything in natural wellness? So thank you everyone for coming. Thank you, thank you.
No, I think he's saying bye bye.